Hello, and welcome to the March edition of Sepsis Chatter. This is called Severe Sepsis and Septic Shock Crystalloid Fluid Administration, Part 2. Today's topic is a continuation of the last presentation, Severe Sepsis and Septic Shock Crystalloid Fluid Administration, Part 1. The information included in this presentation is based on the CMS Specifications Manual for National Hospital Inpatient Quality Measures, discharges January 1st through June 30th, 2023. I'd like to do a brief recap of what was covered in the Crystalloid Fluid Administration Part 1 presentation. We discussed the three triggers that would require crystalloid fluid administration. Those were septic shock per provider documentation, septic shock met by clinical criteria, which is severe sepsis plus an initial lactate result of equal to or greater than 4.0, and severe sepsis accompanied by initial hypotension. We discussed how to calculate the acceptable time frame to initiate crystalloid fluids based on the trigger present. For septic shock, we would calculate 6 hours prior to through 3 hours following the onset of septic shock. For severe sepsis plus initial hypotension, it's 6 hours prior to through 3 hours following the onset of initial hypotension. We also discussed determining the target volume of fluids to be administered, the priority source for the weight within the fluid order, prior to or closest to the onset of severe sepsis, the closest weight documented following the onset of severe sepsis is the hierarchy. Lastly, we cover the crystalloids given at a lesser target volume and the specific documentation needed to answer value 1, yes, for the crystalloid fluid administration data element. Please consider reviewing the Crystalloid Fluid Administration Part 1 presentation if you have not done so, since this presentation builds upon the last one. At the completion of this presentation, the attendee should be able to determine the acceptable time frame to initiate crystalloid fluids in the setting of septic shock, severe sepsis with initial hypotension, septic shock with hypotension and multiple trigger events. Identify the crystalloid fluid administration time based on how the provider orders are written, and also calculate the target volume completely infused or end time. Let's review the crystalloid fluid administration data element. First, the definition. Documentation of initiation of crystalloid fluids within the specified time frame and complete infusion of the target ordered volume. The suggested data collection question. Were crystalloid fluids initiated within the specified time frame and completely infused based on the target ordered volume? There are 4 values to choose from. Value 1, yes. The target volume of crystalloid fluids were ordered and initiated within the specified time frame. Additionally, the target ordered volume was completely infused. Value 2, no. Less than the target volume of crystalloid fluids were ordered or initiated within the specified time frame. The target ordered volume was not completely infused. Value 3, no. The target volume crystalloid fluids was not initiated within the specified time frame or unable to be determined. Value 4, no. There is documentation that the patient has an implanted ventricular assist device or documentation of the patient or authorized patient advocate refusal of IV fluids. As discussed previously, we need to look for the presence of any of the 3 triggers when determining if crystalloid fluids are indicated. The first trigger listed is provider documentation of septic shock. Remember that we can only accept MD, PA, or advanced practice nurse for documentation when determining if septic shock is present. RN, pharmacist, or EMS documentation is not acceptable. Second, septic shock met by clinical criteria would be severe sepsis with an initial lactate of greater than or equal to 4.0. The third trigger would be severe sepsis with initial hypotension. First, let's look at the onset of septic shock and determining the acceptable time frame to initiate crystalloid fluids. We know that septic shock is a trigger, and there is also specific guidance that defines the acceptable time frame for fluids to be given when septic shock is present. The acceptable time frame that the fluids must be initiated can be calculated based on the following guidance. The acceptable time frame to administer fluids is 6 hours prior to through 3 hours following the onset of septic shock. In this example, septic shock is determined by provider documentation at 1 p.m. Fluids must be initiated at the earliest 7 a.m., which is 6 hours prior to, through 4 p.m., which is 3 hours following the onset of septic shock. Notice that the fluids were actually completed greater than 3 hours following the onset of septic shock at 5 p.m. This is acceptable as long as the full target volume was initiated within the acceptable time frame. This initiation would meet the data element. When determining the acceptable time frame to initiate crystalloid fluids in the patient with severe sepsis with initial hypotension, we'll calculate 6 hours prior to through 3 hours following the onset of initial hypotension and not severe sepsis. Also, remember that we are looking for fluids to be initiated, but they do not need to be finished within this time frame. Before we calculate the acceptable time frame for fluids, let's review the onset of initial hypotension. The time frame to assess for initial hypotension is 6 hours prior to through 6 hours following the onset of severe sepsis and prior to the full target volume of crystalloid fluids being completed. Two hypotensive values that occur within 3 hours of each other within that 12-hour time frame surrounding the severe sepsis is required. In the example below, severe sepsis was met at 8 a.m. We're calculating the acceptable time frame from the onset of the initial hypotension date and time and not the severe sepsis date and time. In this example, the onset of initial hypotension was at 10 o'clock, which is within the acceptable time frame for initial hypotension, assessing for it. So the acceptable time frame to administer the fluids is 6 hours prior to through 3 hours following this 10 a.m. time. This is 4 a.m. to 1 p.m. The full target volume of saline was ordered at 3,000 cc's over 3 hours. It was ordered at 9 o'clock and it was administered starting at 11 o'clock and it was finished by 2 in the afternoon. So the crystalloid fluids for this particular example, you would answer value 1, yes, the crystalloid fluids were given within the acceptable time frame and they were given at full target volume. When determining the acceptable time frame to initiate crystalloid fluids when multiple triggers are present, the guidance instructs us to abstract the earliest trigger and calculate the acceptable time frame to give the fluids from there. This example illustrates the presence of septic shock and initial hypotension. The MD documented septic shock in the H&P at 1 p.m. Vital signs on the same date were blood pressure of 89/59 at 12:30 and a MAP of 63 at 1:15. So the initial hypotension for this patient was actually met at 1:15 p.m. Since the initial hypotension was met after the onset of septic shock, the earliest triggering event is the onset of septic shock at 1 p.m. So we would calculate the acceptable time frame to administer fluids from 6 hours prior to the onset of septic shock through 3 hours following the onset of septic shock, which would be 7 a.m. through 4 p.m. Now that we know how to calculate the acceptable time frame for crystalloid fluid administration, I'd like to review orders with you. A single order or multiple orders for crystalloid fluids equaling 30 cc's per kilogram or a lesser target volume is required. Physician APN or PA orders are required for the fluids. The order must include the type of fluid, the volume of fluid, and a rate or time over which the fluids are to be given. The terms bolus, wide open, or open are acceptable for a rate or an infusion duration. Regarding orders and administration times will depend upon whether the MD orders were written as a single order for the full target volume of crystalloid fluids or multiple separate orders totaling the target volume needed. For a single order that is written for the full target volume, use the earliest time that the first bag of fluids is initiated. Multiple orders written for the full target volume, you would use the start time of the bag that completes the full target volume. Let's look at a single order written for the full target volume. Use the earliest time that the first bag of fluids is initiated. The following example: onset of septic shock was at 12 o'clock. The orders written at 11 o'clock were for normal saline, 2,400 cc's, and administer over 3 hours. The fluids were administered as follows. We've got 1,000 cc's that were administered 11:15 to 12:15. We have 1,000 cc's that were administered between 12:20 and 13:20. And then we have 500 cc's that were administered from 13:30 to 1400. The crystalloid fluid administration time in this example would be 11:15 because it was written as one full target volume. Using the same scenario, multiple orders written for the full target volume changes the administration time. In this case, use the earliest time that the bag that completes the full target volume is initiated. The example, which is exactly the same as the previous one except for the orders, is as follows. We've got the onset of septic shock at 12 o'clock. We have the orders separately written out. 11 o'clock, we've got 1,000 cc's ordered at 999 cc's per hour. At 12 o'clock, another order was written. It was 1,000 cc's at 990 cc's per hour. At 1 o'clock, there was an additional order written for 500 cc's over 30 minutes. So then the fluids were actually given the same exact way as the last example, where we had 1,000 cc's given at between 11:15 and 12:15. We had 1,000 cc's given at 12:20 to 13:20, and then we had 500 cc's given at 1:30 to 2 o'clock. In this scenario, the crystalloid fluid administration time is actually at 1:30 in the afternoon instead of the 11:15 as in the last example. Let's move on to determining the full target volume completion time. There are 3 ways to determine this end time based on how the fluid administration is documented. First is the volume and infusion rate. In this example, we have a volume of 1,000 cc's. The infusion is to be running for 500 cc's per hour. The start time is at 8 o'clock. There is no end time documented, so it's up to us to calculate out the end time. Because we have 500 cc's an hour, it's going to take 2 hours to complete this infusion. So the end time is 10 o'clock. The next documentation that we may see is the volume and duration. The volume duration of infusion is as follows: 1,000 cc's over 2 hours. The start time is 8 o'clock. There is no end time documented, so we need to calculate out what the end time would be. In this instance, we have the 1,000 cc's given over 2 hours. The end time would be 10 o'clock. The third way is the start and stop time documented. So the volume is 1,000 cc's. The documented start time is 8 o'clock, and the completion time is 10 o'clock. So those are the 3 ways that you can calculate the end time of your infusion. This example demonstrates determining the fluid end time when the volume and duration of fluids given is documented. The patient met criteria for severe sepsis at 7:30, and the onset of initial hypotension is at 8 o'clock. The patient weight is 74.3 kilograms, which is 2,229 cc's needed for target volume. The acceptable time frame for administering these fluids is 2 a.m. to 11 in the morning. The MD orders are written as follows: normal saline, 1,000 cc's. The rate is 60 minutes, and that was ordered at 7 o'clock. At 8 o'clock, we have normal saline, 1,000 cc's, ordered over 120 minutes. At 9 o'clock, we have lactated ringers, 1,000 cc's, and to be administered over 60 minutes. So the fluids administered are as follows. We have the 1,000 cc's of normal saline that was given from 7:05 to 7:55. So that was over 50 minutes. Then we have normal saline at 8:05, and it ended at 9 o'clock. That was over 55 minutes. Then we have the lactated ringers, started at 9 o'clock, and it was completed at 9:40. If we look at the total volume of fluids that were administered, they equal 3,000 cc's given by 9:40. This patient needs only 2,229 cc's to meet the target volume needed for the 30 cc's per kilogram requirement. In this case, the fluids were given separately in succession, and 2,000 cc's were complete by 9 o'clock. We only need 229 cc's from that final bag. So to determine the exact time that the required 2,229 cc's of fluids were complete, we need to know what the rate of the cc's per minute were for that last bag. The fluids were run at 25 cc's per minute. As you can see, you take the total volume of 1,000 cc's and you divide it by the 40 minutes that the fluids ran, and that will give you your 25 cc's per minute. Because we only needed 229 cc's from this last bag to meet the full target volume for this patient, we would divide the remaining volume of 229 cc's by the 25 cc per minute rate that we determined on the last page. This comes out to 9.16 minutes, or 10 minutes rounded up. The full target volume for this patient was complete by 9:10. And now we have an exact end time to move on to the next data element in the algorithm, assessing for persistent or new hypotension. Our last example demonstrated how to determine the infusion end time when multiple IVs are administered in succession. In this example, we will determine the target volume end time when 2 IVs are running at once. Because we'll be performing multiple calculations to come up with an accurate end time. The first order of business is to calculate the fluid rate per minute for all fluids administered. Let's use 2,250 cc's as the target volume to make this a little easier. So if you look at the fluid orders and the actual time that they were administered, we have normal saline, 1,000 cc's over 60 minutes. It was actually administered over 50 minutes, and we calculated out 20 cc's per minute based on 1,000 cc's being divided by 50 minutes. The second one was the same. It was normal saline. It was 1,000 cc's, supposedly given over 60 minutes. It was actually given over 55 minutes, and the calculation works out to be 18.18 cc's per minute because it was given over 55 minutes. The last one, lactated ringers, was actually given from 8:50 to 9:30, which is 40 minutes. So we're going to divide out the 1,000 cc's of lactated ringers by the 40 minutes, and that will give us 25 cc's per minute. In this example, bag number 1 was given separately from bag number 2 and bag number 3. The first 1,000 cc's of the total volume needed was completed by 7:55. So now we need 1,250 cc's to complete the required target volume. Note that bag number 2 was started at 8:05 and ran until 9 o'clock at 18.18 cc's per minute. Bag 3 was running at 25 cc's per minute and was started 10 minutes prior to bag number 2 being finished at 8:50. So we have a 10-minute overlap when they are infusing together. So now what? We have the information needed regarding the infusion rates for when bags number 2 and bag number 3 are infusing alone, and when they are also overlapping for the 10-minute time frame between 8:50 and 9 o'clock. The next step is to determine the volume of fluid that was administered from bag number 2 alone before bag number 3 is initiated at 8:50. The time frame to calculate the volume given from bag number 2 alone is 8:05 to 8:50, which is 45 minutes at 18.18 cc's per minute. This comes out to 818 cc's given by 8:50. Between bag 1 and bag 2 running as single infusions, we now have 1,818 cc's given. In order to meet the full target volume, we are 432 cc's short at 8:50. So how do we calculate the last 432 cc's remaining? Bag number 2 and bag number 3 infusion rates per minute will need to be combined for the 10-minute overlap from 8:50 to 9 o'clock. The saline running at 18.18 cc's per minute and the lactated ringers running at 25 cc's per minute will be combined for a total of 43.18 cc's per minute, and then we'll multiply that by 10 minutes, and that'll give us our 432 cc's that we need for the full target volume. So between the 3 bags infused, the full target volume of 2,250 cc's was complete at 9 o'clock, and now we have an accurate time to assess for persistent or new hypotension. In conclusion, I want to share a few takeaways before we go. Be aware of those 3 triggers that determine the need for crystalloid fluid administration. Always choose the earliest trigger that occurs when determining the acceptable time frame to initiate crystalloid fluids. Crystalloid fluid administration times are affected by how the provider orders are written. One single order for the full target volume versus multiple orders written. Crystalloid fluid end times can be calculated based on how the infusions are documented: volume rate, volume duration, and start-end times. Know the process related to determining the crystalloid fluid end time when multiple infusions are running concurrently. And lastly, this presentation builds on the information provided in the Sepsis Chatter Crystalloid Fluid Administration Part 1 that's located within the Registry Partners blog. Please refer to the resources listed for further information related to the Sepsis 1 measure. Thank you and happy abstracting.